Hey, good morning, everybody. The event has started and the event is recording. My name is Luke Thornton. I am your WebEx host for today. If you have questions that you would like uh, to ask the panel or their presenter, please send them to me directly in the chat. You'll find the chat feature down at the bottom right corner of your WebEx display. Make sure you send them to the host, that's me, and then I will be able to either call on you or articulate your question for you. And without any more technical stuff, I'll hand this over to Gretchen Lopez.
Luke. Good morning, everyone, and welcome to the Seniors Council of Douglas County's February meeting. We hope you are staying warm and safe during these really cold and snowy days. Definitely winter's here. And we are pleased to be able to meet with you virtually through the generous support of the county and our county commissioners. And we anticipate continuing our virtual meetings for the next several months. And hopefully we'll be able to meet in person in the near future. We're shooting for that, but we will keep you posted on that part. After some initial confusion, we're ready for our first slide, Luke, about the availability of masks in Douglas County. We now know that there are many locations providing free masks, including the libraries, the DC Event Center, and some pharmacies, Sam's Club, and others. Check out the website on the screen for, check the list on the screen for some other locations. You can see that if you are wanting some masks, you can go to, there are several different places to go to. There's a limit of 5 masks per person, but they are free, so take advantage of that if you wish. Okay, we're ready for the next one. Affordable housing for older adults has been a top concern for many of our county residents, and here's some good news on that front. There you can see 3 mentions on the screen there. The first one, the Oakwood Senior Apartments on Oakwood Drive in Castle Rock, has been undergoing renovations and expansion. It is designed for those 55 and older qualifying at certain income levels and has a total of 109 units. The buildings now include 3 floors instead of 2 floors and have elevators, which it didn't have before. It has a beautiful community room equipped with Wi-Fi, a special hearing loop to enhance the sound for those using hearing aids, plenty of large windows to let in the sunlight, a large flat screen TV, and a kitchenette at one end of the room. If all goes well, they will be hosting our July meeting, and we hope you'll be able to join us there so you can see this beautiful new facility. Another exciting addition to the Castle Rock area is Bridgewater Castle Rock. That's the new construction going up on the east side of I-25 North. This facility is scheduled to open this summer with 150 units. It will have independent living, assisted living, and memory care in 3 connected buildings. Some of the units may be income qualified, and we'll be sure to keep you posted and updated on the progress of their construction. A third brand new older adult living facility is the Audrey. It's located in the town center area of Highlands Ranch. It's rumored that this tastefully appointed 4-story apartment complex was named after Audrey Hepburn, but we can't confirm that for sure. This particular facility has 134 units for those 55 and older and opened this past October 1st. It was completely filled by the end of October, testifying to the fact that affordable housing for our older citizens is in dire need. The Seniors Council is reaching out to these congregate living facilities to introduce ourselves to their staff and residents and to ask them to consider joining our meetings and in receiving our First Friday update. Additionally, we will continue to foster positive outreach efforts to the other older adult communities throughout the county. Luke, do we have Mike on yet?
No, we do not.
Okay. Mike Drake, our vice chair, will be giving us a legislative update later in the meeting. Next up is Tiffany Curtin, our education chair, with our presentation schedule and an introduction to our speaker today, Brandon Davis. Tiffany?
Morning, everybody, and thank you for joining us again this month. Before I give our schedule, I just want to promote a couple of things. Awareness of events happening at Douglas County Libraries. We are sponsoring the AARP for their tax prep program. This is free assistance for helping you prepare your taxes. And these are more or less by appointment only, and these appointments do fill up. So I strongly recommend that you call the library at 303-791-7323, and they will give you the contact information to reach out to the tax aid program folks. So we are holding these sessions in Castle Rock and Highlands Ranch and Parker. And also I want to mention that at all of the Douglas County Libraries, at all of our branches, we started having coffee talks, which is just a way to join and have community conversations with you. We provide the coffee, and that's every Tuesday morning from 8:30 to 10 a.m. So really bring a friend, come and make some new friends, and our librarian staff is ready to engage you in some lively and informative conversation, but it is conversation, so we want to hear what you want to talk about as well. So hopefully you are able to join us for some of those. Before I introduce our speaker today, I would like to give you a little preview of who we will be seeing in the next few months. On March 3rd, we will have a science presentation from Dr. Susan Bailey. She has done some work and research with NASA, and she's going to be talking about lessons in aging from what we've learned from space travel. So as you may know, Captain Kirk, the man, has made it up to space finally at the age of, I forgot his exact age, over 80, and made it up to space in real life, not just in the studio. So she'll be talking about some of the science that we've learned from space travel and how that affects aging. On April 7th, we'll be hearing from Dr. Linda Van Meter, and she will be sharing some wisdom in how to navigate some difficult intergenerational conversations with our other generations in our families who might be seeking advice from us, and to help us know how to respond when the lives of younger generations might be full of issues that we never had to experience when we were younger. So she will equip us with some tools to make those conversations successful, and so that we can remain supportive and be good mentors for younger generations. And on May 5th, we will be hearing from Cindy Kaufman. She will be speaking about practical wisdom from an end-of-life doula, which is what she has devoted her life to, and helping us navigate end-of-life situations for our loved ones as well as ourselves, so that that traumatic time can be we can handle that respectfully and have our wishes met. And now I would like to transfer this presentation to our speaker of the day, Mr. Brandon Davis. If you attend our meetings regularly, you'll recognize a familiar face as he presented for us a few months back. Brandon is the SHIP and SMP director. And so he will be talking about these programs more specifically and more in depth than he was able to cover in his previous presentation, which was also shared with, the getting started with your Medicaid options. And so I will turn this over to Brandon Davis, and thank you very much for being with us again today.
Thank you very much, Tiffany. It's a pleasure to be here. I just want to thank everybody just for attending today. I know it's a little cold outside. Being a Southerner myself, this is out of my element. I would like to go into hibernation mode right now, but the show must go on. Let me see if I can share my screen right quick. Let's see here. I should be able to see my screen. Once again, as Tiffany mentioned, my name is Brandon Davis. I am the SHIP and SMP Program Director, and here to talk a little bit about two programs that provide Medicare counseling assistance throughout the state of Colorado. Pretty much the Colorado Health Insurance Assistance Program, or SHIP, and the Senior Medicare Patrol, SMP. Just a little overview here for today's presentation. I just want to talk a little bit about the background and purpose of each program, also the services offered by each program, and some advice for clients whenever they contact these two programs. And last but not least, some contact information of the local SHIP and SMP programs. All right, first off, State Health Insurance Assistance Program, otherwise known as SHIP. First off, there are SHIPs throughout the United States, throughout all 50 states, including Guam and also the Virgin Islands. These programs, they might go by different names. I know in Missouri it's called Claim. Maybe Washington is called Sheba, but it's all SHIP. Me personally, I wish that it was all called SHIP, just to keep things simple. The program was created back in 1990. And it is administered by the U.S. Department of Health and Human Services Administration for Community Living that partners with us at the Colorado Department of Regulatory Agencies, or DORA, Division of Insurance. Pretty much in a nutshell, this program offers no-cost Medicare counseling for anyone with questions about Medicare, and it is federally funded. That's why it's offered at no cost. Pretty much the purpose of the program, a national program that offers one-on-one assistance, counseling, and education to Medicare beneficiaries and their families and caregivers to help them make informed decisions about their care and benefits, more specifically, their health care and benefits. I have the word informed underlined because that's pretty much the goal of a SHIP counselor, is to get you in a better place than before you called a SHIP counselor, and equip you with the knowledge about Medicare that you need to to make a better decision. Some of the services offered, once again, any questions that you or maybe a loved one, friend, or caregiver have about Medicare or Medicare related issues. Education, whether it's one-on-one education or group setting education on the different parts of Medicare. As some of you may know, Part A for inpatient hospital stays, Part B, which is medical, or Medicare pays for medically necessary services, and Part D is your drug. And they also go over the Medicare Advantage plans as well, also known as Part C. No one uses that term Part C usually except for the Center for Medicare and Medicaid Services. So I try to avoid saying that at all costs. So it goes over Medicare Advantage, which acts as a bundle. You know how you have a cable bundle where you have like your TV, your internet, and your phone mixed in together? Well, that's kind of how Medicare Advantage works, as far as your A, your B, and your D sort of bunched in together with some little extra perks of maybe vision or hearing services. Medicare cost savings assistance. SHIP counselors will help you if you're income and asset eligible, of course, with programs that help out with Part B premium costs, such as the Medicare Savings Program, which is administered by the state Medicaid agency, and also Part D extra help, which helps out with Part D drug costs. And that program is offered or administered by the Social Security Administration. They can help you with the explanation of those benefits, also where to go to access them, and also to help you with the application as well. And in some cases, like the Part D Extra Help program, they can also submit those applications online. through the Social Security Administration website. Plan enrollment assistance. In particular, whether you have a special enrollment that opens up to you, let's say you are about to retire, and with retiring, you let go of your job insurance. Okay, that opens up a window, a special enrollment window for you to look at Medicare plans in your area. Or if you decide to make a household move to another address, then that also entitles you to a special enrollment period to see what Medicare plans are in your area. Also, for people who are not entitled to a special enrollment period, there is the open enrollment period where we recently got done with. It is October 15th through December the 7th annually. This period is for people who are not entitled to a special enrollment period, but they find out that maybe not all their drugs are covered, or next year their doctor will not be in their network. For situations like that, we do suggest that people take advantage of this period to look and compare plans, and also get the assistance of a SHIP counselor as well to help compare those plans. And if you do decide to enroll in a new one, it usually starts January the 1st of the following year. I know we get confused with all the commercials and all the mail that's getting up in our mailbox, but for anyone whose drugs are covered and their doctor will be accepting their current insurance, you don't have to do anything. This period is really for those people who are seeing some holes, some troubles in their insurance, and they want to take advantage of this period. I know most people, they kind of get confused on this period where, oh, should I do something? Should I not do something? Well, like I said, if you're receiving those little holes and, drug costs are kind of getting a little outrageous, or the doctor isn't accepting your insurance, again, you may want to take advantage of the open enrollment period. And lastly, advice on the Medicare appeals process. For the most part, you do have statements that come in the mail that tell you the next steps to take if a service isn't covered, but the SHIP counselors are there available to provide support as far as any type of documents you might need to help support your appeals case. And just a little advice for clients. All of our counselors, they take pride in serving you and sincerely want to help you. They put in the hours and work, close to like 30 hours of certification training to be in their position. Most are volunteers, and they take their time out and they're sincerely there to help you. Medicare is complex, and with some issues will require research by the counselor. Uh, as much as all counselors want to know off the top of their head the answers to all Medicare questions, at some point, if it's a really complex issue, they may have to take out time to do research, but they will get back with you. That's one thing they will do. And at times, depending on the issue, counselors will tell you what you need to hear, not always what you want to hear. Some issues are so complex that their goal as a counselor, once again, is to get you in a better situation, or at least equip you with the knowledge and inform you of the next steps or options that you have. All right, the Senior Medicare Patrol. This program was created in 1997, so it's a little bit younger than the SHIP program. It's another program that's also administered by the U.S. Department of Health and Human Services, more specifically the Administration for Community Living. And it also partners with us at DORA and the Division of Insurance. And the SMP, or Senior Medicare Patrol, deals with the other side of Medicare counseling, with Medicare fraud awareness. And once again, this is another program that is of no cost to you, with it being federally funded. The purpose of the program is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report, and remember these three words, they'll come up a little later, suspected healthcare fraud, errors, abuse through outreach, counseling, and education. And you notice here I have the word empower underlined. We understand that Medicare fraud isn't an issue that people want to discuss. We talk about as counselors all the time how the SHIP program gains more publicity and shines above S&P at times, but it's something that people need to realize and equip themselves with the knowledge with. And we understand things happen. Let's say you get a phone call from someone you don't know, and they're asking about your Medicare number, and things, they tend to go so fast that you don't even remember what happened. Well, that's where this education and knowledge comes from, to help to empower you and equip you with the knowledge to know what to do in case something like this happens. Some of the services our S&P counselors provide: simply advice on how to protect their Medicare benefits. They also help clients review their Medicare summary notices. Once again, we can't stop beating the drum on this, to review those Medicare summary notices. It's a quarterly statement that comes in the mail from the Center for Medicare and Medicaid Services. It says strapped across it, "This is not a bill." I, for one, love seeing that. I love it if it's not a bill. You're tempted to toss it to the side, but just take a glance at it, please. Yeah, like I said, it's a ledger basically of everywhere that you used your Medicare benefits or your card. At clinics, pharmacies, and it's a good deterrent to see if there's any irregularities with your Medicare benefits. Once again, education on fraud prevention. And also they help with reporting suspected Medicare fraud. I have the word suspected here underlined because any type of information and tips that we get in Medicare fraud is suspected until otherwise, until it gets to the Office of Inspector General, to where they conduct investigation. And once again, for the Senior Medicare Patrol, this is kind of our mantra: protect, detect, and report. As far as protection, you want to guard that Medicare card at all times. Only use it at places that you trust, such as your clinic, your doctor, or your pharmacy. Don't go waving it around. Don't go giving people your Medicare number. We know we want to help people and get them that new scooter with the 5-wheel drive on it, but no, that number is specifically for you. Even spouses, they don't share Medicare numbers. They both have separate numbers, and that number is attached to you. Detect. Once again, review that Medicare summary notice. Or if you have a Medicare Advantage plan, what would come in is called an explanation of benefits. Once again, that ledger is the best thing to see if there's anything irregular going on connected to your Medicare number. And report suspicious calls, visits, or others that might be requesting Medicare information. Uninvited visits from agents or those claiming to be agents. My thing is, look, if I didn't set up any prior business with you, I feel like you shouldn't be contacting me. Even with the phone calls, I say to myself, hey, if it's important, they'll leave a message. And depending on what the business is involved, depends on whether I call back or not. So remember, it's always okay to hang up and to shut the door. That's the whole point of the Senior Medicare Patrol. If we can give you that knowledge and equip you that you need as far as preventing things, then we've done our job. But we can also report situations if they occur and help you along that process. Some advice. Once again, I'm beating the horse here. Please review your Medicare summary notice, even if it's not a bill. Write down your appointments of who you spoke with at the clinic or at the hospital and what was done during your visit. Also the times, who you spoke with. As you can see here on the left side, we have the My Healthcare Tracker. It's like a little booklet. If you contact your local Senior Medicare Patrol, this is to no cost to you. They'll definitely ship you one right out. Don't be afraid to make a report if you have to. And remember, the more detail you provide, the better. We don't like to be in situations where we feel people have compromised our information, but it all involves the next steps. We want to be able to stop this from happening in the future. So please, don't be afraid to make a report. these S&P counselors are here from you and they understand that things happen, but they'll help you out as far as next steps, as far as looking at your Medicare summary notice a little further to see if anything happens, or looking at any bank account statements to see if there are any changes, you know. All right. If you notice a billing error, contact the billing department first. These hospitals and clinics, they push out so many bills a day, and also they have to deal with so many codes. They would be surprised if someone actually took out the time, looked at that bill, and noticed that there was a mistake on it. So, yeah, don't be afraid to turn right back around, go back to the clinic or the hospital and tell them, hey, I came here to get my blood pressure checked, but, you put me down for heart surgery. That's a mistake. I even got it written down here on my healthcare tracker, and I talked to Dr. Such and such here. You know, let them know. They'll go back around, they'll do a little investigation at their clinic or hospital to find out what went wrong, and they'll be able to change it. Now, if there's a little reluctance to that change, then you contact us at the Senior Medicare Patrol. Remember, if you don't report it, it never happened. So please, once again, I can't stop stressing this. Let us know, please. There are volunteer opportunities available if you would like to be a SHIP counselor or S&P counselor. As stated, counselors, they go through like an estimated 28 hours of certification training, and that's a total for both programs, both SHIP and S&P. Uh, if you don't want to be a counselor, there are other opportunities, such as administrative assistants behind the scenes, or you want to lead presentations such as Medicare 101 or Medicare fraud prevention basics. And of course, outreach. You can contact HR departments, hospitals, pharmacies, clinics, anything in connection with the SHIP program or any organization that's in connection with the SHIP program. And SHIP and S&P contact information. Of course, we do have a statewide SHIP and S&P number, 1-888-696-7213. This is a statewide number. It is voice activated, where it will geolocate you to your local SHIP or S&P by county. And more directly is the SHIP and S&P for Douglas County, which is the Denver Regional Council of Governments, or DRCOG. These are fabulous people. I worked with them before I'm in my current position. They also have a direct SHIP and S&P line, 303-480-6835, as well as an email address. If you don't feel like talking to someone, you can utilize the electronic outlets of ship@drcog.org or the website at drcog.org/ship. All right, and I think that's the end of my presentation. I just want to thank y'all. Do any of y'all have any questions?
If anyone has questions for Brandon, please use the chat feature to send them to the group. You can send them to me, the host. The chat button is in the bottom right corner of your screen.
And if there is any questions, feel free to contact the local SHIP. Once again, the people at DRCOG are awesome. Like I said, whether you have a simple issue or complex issue, they'll definitely get back with you.
A question from Dorothy, Brandon. What is the time period to report fraud?
The time period to report fraud, as soon as possible. Once you notice that something's wrong with that Medicare summary notice or ledger, or let's say you do get on the phone with someone and you kind of get a little savvy with them and get their information. Like, okay, what's your name? Okay, what company are you with? What phone number or can I contact you back with? Okay, let me refer a friend, wink, wink, nudge, nudge. And you can contact them from 8 to 5, Monday through Friday. Any other questions?
Last call for questions. I'm not seeing any other questions at this time, Brandon.
Okay. All right. Hey, if anything else comes up, be sure to contact our programs, please. Like I said, we are here for you, federally funded, no cost. You are the reason that we're here. Thank y'all.
Brandon, I will offer a personal story. When my father was hospitalized in New York and I was living in Ohio, my mother sent me some of the explanation of benefits and bills. And there was a service on there that supposedly he received, and she was very insistent with me. She said, Dad never received that. So I did call the doctor's office and got it corrected because it was an error. And
Mhm.
often it's done innocently. I mean, we're not suggesting that doctors and healthcare providers out there are intentionally doing this, but they process so many claims in such a short amount of time, and we were able to get that removed. It was a $1,400 charge
Oh, yeah.
for a bone scan he never had. So I would definitely support your instruction to everybody to look over those bills carefully, and don't be afraid to bring it to somebody's attention, because if the Medicare funds are paying for ineligible claims, that's less money there for legitimate claims, and you want that money to be there when you have a legitimate claim to be paid.
And it also affects that yearly Part B premium. Oh, that's one factor that affects it. People wonder all the time, like, why does the Part B premium keep going up? I think right now this year it's like $170. Well, one part of it is fraud. So, like I said, do your part in deterring this. And even if, you reminded me of something else, Gretchen. People, they look at the Medicare summary notice, they notice that something's on it, but they notice Medicare didn't pay anything on it. And they're like, "Oh, well, Medicare didn't pay nothing on this. It's okay. Just toss it to the side." No, like I said, please report that because there could be a pattern nationwide of something like that going on that needs to be handled.
Gretchen, have a attendee who wishes to just introduce themselves to the group.
Okay.
And I'm going to unmute Fonda and ask if she would like to introduce herself. Fonda, you should be able to speak now.
All right, thank you, Luke. I was trying to unmute myself, and I'm like, what am I not doing? Anyhow, I wanted to introduce myself. I'm Fonda Buckles. I am the new ADRC manager. Hi, Brandon. Hi, Gretchen. I know you and I have been trying to make contact.
Yeah, we've been playing phone tag.
Yeah. So I just started on the 18th of January with Dr. Cog. So I don't know if I'll be the one attending these meetings or maybe I'll share that with, I think it might be Erica or somebody else that attends. Just a little bit real brief about myself. I have probably over 16 years of my latest career working with older adults, meaning with adult protective services at the county and the state level, managed senior services in Broomfield County for 2.5 years. So primarily I've been working with the older adults and adults with intellectual and developmental disabilities. And I'm grateful to be here and thank you for all that you do. And I know how important senior councils are in the different regions. So thank you.
Good to hear from you, Fonda. And I'll be in touch after the meeting sometime today if you're going to be around.
Yeah.
Okay.
I have, just so you know, from 2 until 3:30, I'm open.
I'll try and catch you then. If
Right.
not
Thank
today,
you.
tomorrow. Yeah.
Thank you. Thank you guys for letting me attend and great presentation. Thank you.
Thanks, Fonda.
Excellent. Well, thank you, Brandon, for sharing that important information about SHIP counselors and also about the Medicare fraud program, Senior Patrol. Very, very important programs. Lots of help out there for folks. So thank you for sharing that with us. Now I'd like to introduce our Vice Chair, Mike Drake. Mike has information on an important bill that we need to know about. And so he's going to educate us on this, a new modernization of the Older Americans Act. So Mike, please fill us in.
Okay, first of all, let me just check to make sure you can hear me all right. I've been having trouble with my computer this morning and I had to switch computers. So I got a little bit of glare from the window behind me. But I'm just wondering, can everybody hear me okay this morning?
Hear you.
Yes, you sound great, Mike.
Good. And just a second, I have to kind of switch things around here. And Brandon, I did, I think that was a great presentation. And there's a lot of information in there, even I could use here. So yeah, I think that was a good presentation to what I caught of it. Well, what we wanted to talk about this morning was the Strategic Action Planning Group, which is at the state level. And they're somewhat advisory to the governor's office. And they're doing I forget how many year plan. I think it's a 30-year plan is what they're working on eventually. But they're making a study of what is happening within the state of Colorado on aging programs. And as most of you probably are aware of, the aging programs here have been established since, roughly about in the middle 1960s, 1970s, at which time the Colorado Commission on Aging was established. And this bill I'm talking about is what they call the Modernization of the Older Coloradoans Act. And it's completely redoing what is happening in the state of Colorado as far as aging programs are at the government level. And it will have some effect upon some of the local programs as well. The bill was introduced in, I believe it was in January, first part of January. It's House Bill 22-1035. And it was assigned to, and let me read that here, Public and Behavioral Health and Human Services Committee. And their first hearing on it is tomorrow. And I intend to listen in on it to see what takes place. And it's going to be in room HCR 0112 upon adjournment of the General Assembly tomorrow morning. The bill updates the Older Coloradoans Act, and the purpose of the act, the portions of which date back to the 1960s, as I said, 1970s, is to support older Coloradoans through community planning, social services, health, and well-being services, and strategy to prepare the state's infrastructure for the growing number of seniors that we have here in Colorado. And Luke, if you can put up my slide number one, the one on the it says there it was scheduled it was scheduled for tomorrow, and the updates, as I mentioned, do include updating the Colorado Commission on Aging, and I'll get into that a little bit later as to what they're planning on doing. Currently, the Commission on Aging has 17 members, 17 members, which are appointed by the governor, and there are 2 from each one of the, I believe it's congressional districts, and they have to be approved by the state Senate.
Excuse me,
And they're
Mike.
supposed to be representatives of the each political party.
Mike,
Now,
Mike, can I interrupt real quick?
yes,
You're breaking up pretty bad. Will you please?
go ahead.
You're breaking up pretty bad with your because of bandwidth. Will you turn your camera off, and hopefully that will solve our audio issue.
Yeah, let's try that.
And let's leave that off, and hopefully that should work for us. Okay, great. Go ahead. Thank you.
Okay, is that any better now? Okay, yeah. As I mentioned, they are reorganizing the Colorado Commission on Aging, and they're increasing it from 17 members to 19 members. And as I mentioned, the 17 members are appointed by the governor, and they represent each one of the congressional districts within the state of Colorado. I'll go into in another slide as to what the new composition of the commission will be, and there will be 19 members. And there's also a provision appointing the State Department of Human Services to act as primary contact, which they currently do through their Division on Aging. So I don't see any change there. And it's for the commission to coordinate the commission related duties with the department as well as other state agencies. And that's something I think is a little bit different. Before, I don't think they had the authority, or did they really coordinate, but now they're being, through this act, they're being told that they will coordinate with other state agencies on services for the aging. And then they're going to convene. Let's see, just a minute, Mike. There it is. They're going to convene a what they call a technical advisory committee, comprised of key state agency representatives to direct implementation. So the state agencies will be having other state agencies will be having input into what the commission and any plan that comes up. And then they'll be creating within the state of Colorado a lifelong initiative within the State Department's Office on Aging to coordinate strategies and implementation of the plan committee and other state agencies. And let's see if that covers the. No, I'm sorry, I'm jumping back and forth here because this computer and having to do this at once is made a little complicated for me here. Yeah, so we covered everything there. And the bill itself is approximately between 24 and 25 pages in length. And it outlines steps being legislated to implement this new approach to aging within the state. Now, if we can go to slide 2. It tells us, as I mentioned earlier, they were going to change the composition of the board. And you can see what they have proposed for being the representatives on the board. And you can see there's going to be one representative from each congressional district. And again, these are appointed by the governor and are not approved by the Senate. These are all gubernatorial appointees. And the representative, there's going to have a representative from higher education or the community college system. They'll have a representative from the area agency on aging, one representative from an area agency on aging. Which area agency on aging, I don't know. It's anybody's guess at this point. A member of extreme knowledge of workforce issues impact upon older Coloradoans. A long-term representative, long-term care representative. Colorado, a representative representing Coloradoans living with dementia. A representative of the organization providing home and community-based services. And a person of extreme knowledge of or experience in the transportation infrastructure. A representative of the housing sector. A member of the public policy community involving aging policy issues. One member of the state Senate and one member of the House of Representatives. So, and if we can go to slide 3, it shows what the characteristics will be of the membership. The characteristics of the membership says that no more than a minimum majority affiliated with the same party, and members must represent a wide range of diversity. Now, by that they mean they want persons who are representing the various various diverse racial, cultural, socioeconomic, gender, and ability groups. So they want someone to represent that particular or group. Well, they don't say one, they say members must represent a wide range of these different groups. And from the congressional districts, the persons representing the congressional districts, they want one person who is at least 60 plus years of age, or person with a disability, or has a family member living with disability. And they want one person to represent what they call rural or frontier areas. This one kind of bothers me a little bit. I'm primarily from Eastern Colorado initially, but I've worked throughout the state. And I have trouble seeing one person representing those diverse areas from Eastern Colorado clear to the Western state, because they have different needs and different wants. And the population is somewhat different too there in those areas. So if you have somebody from Burlington trying to represent Craig, you might have some problems getting proper representation of the area they're not representing. But that one bothers me. And one member from at least local government, and at least one member of the business community, and members once they are selected and put into onto the commission, they will select their executive committee, and they will be meeting once a month, whereas I think right now it's once a quarter. And then they will be establishing their subcommittees. Now, the term limits of these individuals, now prior to this, I don't recall that there were term limits. I remember people being on there at least 20 years or longer when I was with the State Office on Aging. So right now they're having the maximum, and I'll just read it right here. Maximum majority appointed by for the initial terms of 2 years each. That is initially to get this commission established. They want a minimum majority appointed for a 2-year term. And then the remaining members will be appointed for 3 years. So they have a switch every year or so of members. And the expiration of the term of the initial term is 3 years. So that's going to be the maximum number of years they can serve, but they can serve no more than 2 full consecutive terms. So you'll be having the turnover from time to time of members. Now, just a second here. Let me just take a quick look. Okay, James. Okay, now, as I mentioned, this bill is over 24, 25 pages long. And Luke, if you can switch over to slide 4, I'll end this portion of the program by saying that here's where you can find the actual bill itself as it is introduced into the state legislature. This is you have to go to legislative.com.gov, and within that site, there's a place where you can find the bill. You can just click on it, and then it gives you an option to see all bills, which brings up all the bills within the House. And all you need to do there is scroll down. It's on the second page of those bills, of the list of bills. And you can scroll down to House Bill 22-1035, which says here on page 2. And you'll be able to see the entire bill in itself. And I think I've covered most of or all of the highlights of it, but you can see for yourself what the bill is. And again, the hearing is tomorrow, and there may be changes, may not be changes. We'll have to wait and see. So are there any questions or concerns somebody has at this point?
I'm not seeing any questions.
Well, good. Okay. Well, that's all I have for right now, and we will keep following this bill. And there may be some others come up later, but I haven't seen them yet. But we'll keep everybody posted on what's going on with this bill, because it will have some impact on what we are doing here at this level. So with that, I'll turn it back over to Gretchen.
Thanks, Mike. Yeah, it's really important for us to keep on top of the progress of this as it works its way through the legislature. And we'll have occasional reports on our meetings on how it's progressing, how it's changing, and how it's going to be impacting us here at the local level. So something to keep our eye on for sure. Thanks, Mike, for that report. So now I'd kind of like to have a few minutes to ask a few questions of the group in the form of a community conversation about Medicare. Most of us listening in right now, you're either on Medicare in some form or know of someone, either a family member or friend on Medicare. And it's undergone transformations over the years, since it first began in the mid 60s. And I'm just wondering if the group has any ideas on these questions. Is there a benefit that you'd like to have added to Medicare? For a long time, it was prescription drugs, and then Medicare added that benefit. They've improved some of the home health care benefits. But I'm wondering and asking the group, anyone can chime in, if there is a particular benefit that you think Medicare should add to its program. Now is the time to speak up.
Hearing aids.
Yes, that would be a good one. I hope Brandon's listening.
I'll chime in and say, if you put hearing aids on there, the hearing aid batteries are probably a good thing to add to that too, huh? Dental.
Oh, dental. Mm-hmm. Now, some of the Medicare Advantage plans have some of these things, but it's not part of the traditional original benefit package, right, Brandon?
Correct. For the longest, since being involved with the SHIP program, even back in Mississippi, back in before 2017, there was something I always thought about, like, okay, well, Medicare Part B, it covers medically necessary. Okay. All right. So vision and hearing isn't medically necessary. Like, it's part of the body, right? So yeah.
Well, that's why I'm posing the question, because what we might as Medicare beneficiaries think is medically necessary, and then what the government thinks might be two different things. But if we can start a conversation, if there's enough of us saying, as in the case of prescription drugs, that was an ongoing discussion for quite a while, where Medicare beneficiaries said, no, we really need this. No, we really want this. And there was a big push, and it finally happened. Took a while, but it finally materialized. And so that's why my question today is, what else would a Medicare beneficiary like to see in the Medicare program? And yes, many of us use hearing aids. And the battery issue, Luke, is many of, for instance, the hearing aids that I use, they don't use batteries anymore. You put it on a charger, just like you do your cell phone, and it gets charged overnight, and it's good for the rest of the day. Now, there's still some older models that do use batteries, but I think the technology in the hearing aid industry is moving more towards rechargeable type devices. So just as a heads up to everybody, all you younger folks who don't use those devices yet.
I confess my ignorance.
Oh, that's okay. That's okay. Batteries are still out there. And it's very difficult. I know when my mother was alive and she had her hearing aid, she was using batteries, and it was very difficult for her to get those tiny little batteries into a hearing aid. I mean, it was with the dexterity of fingers who have arthritis, it's not very, user friendly. Let's just say that. But dental is a big one, especially if those folks need dentures of any type. There are some dental benefits in some of the Medicare Advantage plans. Might be limited, you know, it might be good to have those expanded if we could. Any other suggestions from the listeners and the viewers today?
Are glasses included?
Only after cataract surgery, right, Brandon? Yeah.
Correct.
Okay,
So,
I've had that cataract surgery and I haven't received a notice or anything, and I've had several pair of glasses since then. So, what do I, as a recipient of Medicare, need to do in order to make sure my next pair of glasses are covered?
Go, is it an Advantage plan that you're with, Mike?
I
Or just
believe
original Medicare?
I believe it's got Advantage.
All right. We always tell people to go back to the plan and sort of get your questions ready and to contact the plan and see why this isn't covered.
Okay. All right,
Brandon,
thanks, Brandon.
yeah, Brandon, correct me if I'm wrong, but my understanding is that under original Medicare, which all Medicare Advantage plans have to cover all the benefits of original Medicare, and they might add special ones after that. But after cataract surgery, someone's entitled to a pair of glasses immediately after that surgery,
Medically necessary.
not glasses subsequent to that. Is that correct?
Yes, because the key term is for that part B is medically necessary. So with having those glasses right after surgery, it's almost like you getting a walker after a surgery or some crutches. So yes, and if there's like a situation where okay, well, the plan decide not to cover it, then go back to your plan. If you have a Medicare Advantage, to try to appeal it, or if you do original Medicare, uh, try to appeal it with them, because I know with your Medicare summary notice, there's instructions on if you feel that you have a claim that you want to appeal, follow these instructions. And those appeals, they go in levels. So if you're still unsatisfied with the first appeal, go up to the second. If you're unsatisfied with the second, go up to the third, even then the fourth. And to the fifth and the highest level, it's almost like a ladder, is the federal judge. So keep building your case, keep getting documents together and stating your case to the point where it gets to that judge, whatever he or she decides, it's final after that point.
Well, that's a
Okay.
good thing to mention, Brandon, too, because a lot of people don't realize that there's quite an extensive appeals process available to Medicare beneficiaries, and to try hard not to give up. I mean, if you start
Yes.
just initially and you go back to the plan and they say no, you know, if you
That's
really believe your case has merit, don't give up. I know when I was a ship director in Ohio, we had one of our volunteers, that was his specialty, the appeals process, Jack Cahucci in Cleveland. Oh my gosh, he was a pro at it. And more than 50% of the cases that he presented all the way through the entire process got overturned. So yeah, hang in there and don't give up if you have a really strong case.
Oh yeah.
So,
Explain, like I said, explain that medical necessity. And I guarantee you it'll get overturned. And another thing that I wanted to mention that just came to my mind, as far as on the Medicare fraud side of things, COVID testing. As y'all know, the government, they're giving away some free COVID tests for at-home COVID tests, and the website for that is covidtest.gov. Either that, or you can go to a site that's connected with the Department of Public Health and Environment. There are sites all over Colorado. So remember, covidtest.gov. Don't trust anybody if they come to your door talking about, hey, we're giving away COVID tests. All we need is your Medicare number. No.
and I've used that site and I've already received mine, so it works. I can tell you it works. Any other suggestions for additional benefits from from the audience?
Podiatrist services.
Say again.
Podiatrist.
Well, okay. I think there are some. Are there not, Luke? Some podiatrist coverage there? Brandon?
Let's see, podiatrist. And
I
these are
know.
one of the situations
I
that make
think
me try to
especially for
research.
people with diabetes, isn't there, for instance, they can get their nails clipped because it's very dangerous. There's a bleeding problem with diabetics. I think there are some limited podiatrist services, depending upon your plan.
Yeah, well, once again, like I said, if it's medically necessary, for a podiatrist, you can also probably get a note from your doctor also to explain that medical necessity. It can get covered by Medicare.
Okay. Well, I've got another question here for the audience. What do you find most difficult in using your Medicare plan? What kind of difficulties are you running into when you try to use your Medicare plan? Anybody have any thoughts on that?
I guess I can say from the ship counselor perspective, they do run into situations involving oxygen, it seemed like. That's the one thing that comes to my mind. Because
The fact that they need more oxygen and can't get it, or the delivery of it,
yeah,
or
and
what specific?
maybe the coverage of it, because I know that it involves like sleep study tests, and it just seems so like to the point where it's like, oh well, if you don't meet this certain level, then we can't cover you for an oxygen tank or whatever. And it just seemed weird to me. Like once again, it's one of those things where it's like, we all need oxygen to breathe. Like, I don't get
Yeah,
it.
yeah. Well, I mean, to be kind of like a devil's advocate on any of these issues, there has to be a certain set of criteria. I mean, people can't just say, "Hey, I want oxygen." I mean, do you need it? Do you really need it? Is the question, I think.
In addition to sight and hearing, eh, free oxygen, you know?
Free oxygen. Yeah, give us some air.
I know I'm not in the audience and everything. I'm supposed to be staying impartial, but I'm sorry. It's just oxygen is supposed to be free like water.
Yeah, very necessary for life. That's for sure.
That isn't that
Uh,
medically necessary?
Yeah, I would say it's quite up there. One of the things I'll throw out to the audience to see if there's any reaction to this is, has anybody run into the situation where they can't seem to find a doctor willing to accept Medicare?
Uh,
I've personally have not had that experience, but I have heard others talk about, I'm trying to find a doctor, I'm switching plans, nobody seems to be accepting Medicare beneficiaries right now. Has anyone else on this call, this meeting, experienced that?
ship counselors have ran into that where it's mainly on the original Medicare side with the red, white, and blue card. Uh, Once again, that's another reason to maybe do research prior to open enrollment to see if a particular doctor will be taking your current plan or not. Um, that way you can get that particular plan that they're going to be going with next year. Uh, yeah, but that's usually with the red, white, and blue card. You do have doctors out there that are saying, "Hey, Medicare doesn't pay me on time as far as the red, white, and blue card, and I don't get my money fast enough." It's like, well, you're a doctor, you're making more money than I am. So, but yes,
Yeah, but
definitely,
they have a lot of debt too, so
yeah.
medical school. Yeah, and what I've found too, and it's not only just doctors leaving plans perhaps, but like my PCP retired doggone him anyway, sold his ranch and moved to Oregon. So I was on the search for someone else. And fortunately, I found another excellent doctor that was willing to take my Advantage plan. But I have heard people saying, you know, they've lost their physician for whatever reason. Maybe they're moving, or the doctor leaves the network, or the doctor retires, like in my case, and they're having difficulty. So no one else on this meeting has had that experience or know of anybody? I don't hear anybody chatting about that. No?
I also want to add that SHIP counselors can look up physicians that are accepting your red, white, and blue Medicare card on Medicare.gov also. So once again, contact your SHIP counselor.
Valuable, I know. And the last question I have for the group is, how can Medicare improve its service to you? The program itself, how can it improve its service to you? Any ideas on that?
This is Mike. One problem I've been having is, and I'm under Kaiser, is recently I've had some expenses through the Medicare, and all I receive is a notice that X amount of dollars have been paid, and so far it has left me with no payments. It's paid everything, but I don't get a detailed report as to what was paid, and we're talking substantial amounts of money here. And I'm wondering, is there something I'm doing wrong, or is there something more that I need to do?
And that, Mike, that really speaks to how can you look for fraud if you don't get an itemized bill?
That's right. And I don't get an itemized bill. I just get a bill that has been paid.
Brandon, do you have any insight into that, maybe?
Yeah, if it was me receiving that bill just showing that it was paid, I would look it over, see if there's like a contact information number on it to maybe get some detail about what it was that was paid.
Yeah,
And you know,
I did that. Mhm.
and if the person, like the customer service person, can't explain, then try to take it up to the next level, maybe to customer service manager, maybe.
Yeah, I think it's really important for us to get itemized bills, because, you know, if we want to be helpful in the fraud area, there's no way we can do it without that information. So
And
good point, Mike.
and also, like I said, if Kaiser, if they give you like an explanation of benefits, that should tell like more detail of what it is. But still, you know, you can also contact them directly before that even comes to you.
Yeah. Okay. Hmm.
Appreciate it. Well, I can say that I really appreciate the fact that the Medicare handbook has improved over the years significantly. I remember back in the day when I was a ship director many years ago in Ohio, it just started, so it had plenty of improvement, but it has become more readable. The important information is up front. You don't have to dig for it, like the changes and all like that. So kudos, Brandon, to anybody over in Medicare that have been working on that publication. I think it's been improved remarkably over the past several years, and very helpful.
Oh yeah. And I'll just tell anybody that Medicare handbook is a reference guide. Don't read it from front to back. It's only if you have a question that you need an answer to right quick and you go to that certain page. Because a lot of people, they'll read it front to back and then they'll end up getting confused. So
Well, then they can always give your counselors a call to get a little bit clarification.
there you
So
go.
that's always a good thing to remember. Well, thanks again, Brandon, for all your expertise and your insight. We are excited to know that our Medicare beneficiaries in the state have such a wonderful resource in your program. So thank you so much for being with us again. A quick reminder to everybody to be on board for next month's trip to outer space and back with Dr. Susan Bailey on March 3rd. Blast off is 10 a.m. and we don't want to leave without you. So put it on your calendar. And here's our contact information. Luke, if you could bring that slide up. As you know, we record our meetings, so if you'd like to hear Brandon's presentation again or know of someone who could benefit from his expertise, please visit us on our YouTube channel. And our other presentations are there too, in case you missed one or would like to hear another one again. Also, you may contact us via email to let us know how we're doing, or to sign up for our electronic newsletter, First Friday Updates. And of course, the February First Friday Updates going out tomorrow with plenty of information. Or you can visit our Facebook page for more information about our upcoming meetings and any events we might be planning for the future. Well, that about wraps it up for today. Please be safe out there, and we look forward to seeing you next month. And as always, stay healthy and stay connected. Bye now.